Kappa walks stiffly in the hindquarters and shows pain in the pelvic area. In addition, he trembles in his front legs. The owner has already been to the PTA, who advised to wait with the treatment. In addition, a seashell compound was given. When there was no improvement in the gait, the dog was brought to our practice for a second opinion. Kappa's movement pattern is very stiff. He shows reduced bending in both knees. In addition, there is toe widening in the left pelvic limb. On the right side, the pelvis is low, which causes an obliqueness. The left shoulder is less expansive. In movement, Kappa walks in a right outset position and traverses over the right shoulder. From the side, a lameness of the right and left pelvic limb can be seen. In addition, both pelvic limb masses are in an anchovature and are placed under the center of gravity. Again, it is visible how the bending of both knees is reduced. The back shows kyphosis. In general, the hindquarters show little drive. Kappa performs a pull move and pulls mainly with the forehand. The left pelvic limb is passively pulled and appears even more ponderous. On the Volte it also shows, Kappa's movement is clumsy. The drawn-up back has an even greater effect under these circumstances. In addition, the lameness of the sloping legs has increased on both the right and left side. We are talking about turning pains here. Especially the left pelvic limb mass seems to be strongly reduced in movement. Also, the toe widening has increased. Last but not least, the pelvis tilts when sitting. The left side appears much more unstable. We diagnose Kappa with bilateral hip dysplasia. Moderate on the right side, severe on the left. In the short-term therapy, the pelvic axis was treated orthopedically manually. Blättler-Monniers was also prescribed as injection therapy until the pelvis was fully grown. Depending on the progression of the clinical symptoms, an individually tailored hip joint prosthesis, a custom-made TEP, is indicated. The kinematic data of the gait measurements support the diagnosis. The reproducible movement features also indicate hip joint dysplasia.